Hello, I'm Dr. Robert Luce, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about lichen sclerosis. This is a condition of irritation, chronic irritation of your vagina, the outer part, the labia, the lips, the inner part, or the outside around. Can be quite uncomfortable, can last a while, but thankfully there's some great treatment for it. So the words lichen sclerosis, the word lichen comes from like an algae that you see on trees in the forest. It's kind of what it looks like, a little scaly, a little whitish. And sclerosis means thickening, hardening. So lichen sclerosis, skin condition of the vaginal area that is itchy and scaly and thickened, and can cause a lot of chronic discomfort. And you need to see your physician, preferably a gynecologist, to diagnose it. Often you'll need a biopsy to confirm it, not always, depending on your risk factors. If you're a smoker, if you had prior abnormal pap smears, that increases your risk, or if things don't get better. But so it's not an absolute requirement. Often we do use a biopsy to confirm it. There is a small chance. There are many other conditions that can mimic it, including cancer of the outside of the vagina. Thankfully, that's very rare, and much more frequent, unfortunately, when we see the lichen sclerosis. So it causes this dry, scaly itching, and the treatment is often some pretty strong steroids. We use commonly clobetasol. You may also need some antibiotics because there's often a skin break that causes infection, and then you may also need some vaginal estrogen. So once you've had it diagnosed, usually you'll have one or all of these medicines. Clobetasol is a strong steroid. That's what you use when you get a bug bite. Hydrocortisone is a much milder one that you put for a bug bite, but clobetasol is very strong. But it's a double-edged sword. It thins the skin, but it also can thin your normal tissues and can increase your chance of getting tears. So we only recommend using it for up to 2 weeks in a row. We also recommend you use some vaginal estrogen. You may get recommended that, but it's often occurs more often in women who are older or in menopause, but not always. There are some younger who have it. So, if you're in menopause, we'll often recommend that you use vaginal estrogen. That helps thicken the vaginal tissues and reduce your chance of having itching as well. If you're using vaginal estrogen, some of the preparations have alcohol in them. And just like if you take some rubbing alcohol and put it in your hand, it doesn't hurt, doesn't bother you. But if you have a cut, to disinfect it, you put it on, it burns. So if you're putting vaginal estrogen on, then you may have a cut or a burn, and that could be secondarily infected. Now, steroids, clobetasol, tells your body, hey, don't worry about what's there, chill out, stop responding. So stop being itchy and inflamed. See, inflammation is your body fighting off an irritation or an infection. The problem is if you put the vaginal estrogen on and it burns, you may have a cut or an infection. And then if you use clobetasol, the steroid on there, it might calm it down, but it will help prevent it from healing, which is exactly the opposite of what you need. Okay, so if you're using your cream and you start noticing burning, then you might need an antibiotic, a topical antibiotic. And so the bottom line is you need to be seen by your provider. And that's also why if you're not getting better after 2 weeks of treatment and it doesn't help, but it may come and go and flare, then that's when you need to see your provider. So the clobetasol reduces the scaling and itching over time. The vaginal estrogen helps maintain your vaginal tissue's elasticity. I have a whole separate video on vaginal estrogen. And if you get a micro tear or vaginal infection or something called atrophic vaginitis, then you might need a local antibiotic, for example, Metrogel or metronidazole. So hopefully this will help with how you treat it chronically at home. This may last for a few months or even a few years. So understanding the interplay of these medicines is quite helpful. But bottom line is, if you're not getting anywhere, if you're miserable, don't be miserable for weeks or months on end. Get seen by your gynecologist so they can help you out. And if you have never had a biopsy and things aren't getting any better, or things are growing or getting worse, be sure and get seen. You might need to get a biopsy to find out if there's some other condition going on. I hope you found this information of use. Please leave your comments. Thank you.